Yeah, of course. Hi everyone, I'm Mercedes Morales Aleman and I'm an assistant professor at the University of Alabama. I'm in the College of Community Health Sciences, but I was a Health Services Outcomes and Effectiveness Research Fellow here at the CCTS for 2 years. So I'm really happy to be here and to be back for this talk. So I'm going to be talking to you today about qualitative research methods. And it's going to be a really broad overview because, as you might imagine, just like quantitative research methods, qualitative research methods is an enormous topic to try to cover in one morning. So we're just going to skim the surface and give you an idea of what all is involved in qualitative research methods, and then we'll go from there. So I want to start by telling you a little bit about myself. Which, as you'll find out, is a very qualitative research method sort of thing to do. I'm a community psychologist by training, but a lot of my work is in public health. I work at the CDC for a couple of years in the EPI branch of the Division of HIV and AIDS Prevention. And most of my research is around sexual health promotion with Latino communities. So my work is really focused on partnering with community members to create programming for sexual health promotion with ethnic minority communities. A lot of that work is qualitative in nature, and I've been doing qualitative research for 18 years or so. So with that, we'll dive in. So what I hope that you'll get out of this presentation is to get a sense of, actually, before we do that, let's start with something else. Why don't we do a quick poll of where you guys are in terms of your knowledge of qualitative research methods. So how many of you would say that you are beginners or novice level, maybe have read a couple of articles around qualitative research but don't really feel comfortable with it? How many of you would say that you're kind of intermediate users of qualitative methodology? So maybe you've done some transcribing or coding or done a project for class, taking some content in it in didactics, but not really, wouldn't really feel comfortable doing your own study. Okay, so there's a couple of you. Oh, no. Yeah. Okay, how many of you would say that you're proficient? You would feel comfortable designing and conducting your own qualitative research study? Okay, and experts? Okay, so that just gives me a sense of how to tailor what I'm going to talk about a little bit. So, like I was saying, what I hope that you'll get out of this talk is to get a general sense of what qualitative research is and be able to discuss that. Talk about what are the approaches to qualitative research. Again, this is one specific way of sort of categorizing this. There is not one way, just like with any methodology, and be able to list at least one approach. Be able to identify what kinds of questions you can approach with qualitative research, and be able to list 3 to 4 steps involved in conducting qualitative research. So let's start with a definition, and this definition is from Creswell. And the reason why I like the Creswell text in teaching qualitative research methods is that Creswell is all about the application of qualitative research. It's not about the philosophy of how we know things or how we construct reality. A lot of qualitative methodologists kind of focus on these more abstract theoretical concepts, which is great. With regard to public health, though, I find that Creswell is really useful in that the focus is very applied. So let's read through this. Qualitative research begins with assumptions and the use of interpretive theoretical frameworks that inform the study of research problems, addressing the meaning individuals or groups ascribe to a social or human problem. To study this problem, qualitative researchers use an emerging qualitative approach to inquiry. The collection of data in a natural setting sensitive to the people and places under study, and data analysis that is both inductive and deductive and establishes patterns or themes. The final written report or presentation includes the voices of participants, the reflexivity of the researcher, a complex description and interpretation of the problem, and its contribution to the literature or a call for change. So there's a lot in there, so let's break it down. All right, so qualitative research addresses a social or human problem. So usually you're trying to get an in-depth understanding of social phenomena, of something that is occurring between human beings. This second piece is really important, and it differs a lot from traditional quantitative research. So qualitative research usually happens in a natural setting. So you don't have participants come to you in your lab and do a qualitative research study usually and do an interview. You usually go out to them. So you interview folks at coffee shops, at their homes, in community centers, wherever they are comfortable really talking about the things that affect their lives. You can use inductive or deductive reasoning for qualitative research, and I like to mention this because the sort of traditional qualitative theorists who are purists always sort of imply that the true way to do qualitative research is that it must be inductive, that you must start with a blank slate and go from the observations into the theory. That's not necessarily true. Sometimes there are questions that you can tackle with deduction because sometimes we do know something about the subject that we're trying to understand, and we can start with that theory and go from there. So next, qualitative research is about trying to understand themes or patterns across different subjects or different focus groups or different sets of documents. So whatever your data source is, you're trying to identify the things that are consistent across. And finally, when presented, qualitative research includes the voice of the participants and a reflection of the research. And again, this is really different from quantitative research. So when I say that it includes the voice of the participants, what I mean is that you literally take the quotes from the participants and they become inserted into your written conference presentation and into your peer-reviewed articles. Yes?
Some question, when you say qualitative research occurs in a natural setting, so if you were to do a focus group here at UAB, does it take away from, the research and validity as far as
not necessarily.
You're not in a natural setting?
It depends on what your subject population is. If I'm interested in understanding the ways in which assistant professors at UAB feel about the research environment, then this is their natural setting. If I'm interested even in trying to understand how folks in Birmingham feel about a particular subject, it's possible that they might feel comfortable coming to UAB. Now, I'm not going to take folks from Pickens County and say, come to UAB to a focus group about, healthcare access in rural settings.
If you're talking about patients, they come to UAB, so would that be sort of natural to them?
Sure, yeah. Potentially. It depends on what it depends on what you're trying to understand. If you're trying to understand something about the patient experience specifically, then yes. If you're trying to understand something about their social context, then you probably want to be out in whatever community they're coming from. So, for instance,
trying to understand, for example, obesity and how they perceive diets and bariatric surgery. Mm-hmm. Would there be value to doing it, at their local community versus bringing them here? It's more convenient for us.
Sure, of course. It's always going to be more convenient for the researcher to do it in their own setting. Again, it depends on what you're trying to get at. So if you're trying to get at the ways in which social context has to do with obesity, so if you want to ask questions about like food deserts and and walking trails in their community, you probably want to go and recruit in that community. However, if you're trying to understand the the specific characteristics or factors associated with obesity in your specific patient population who's obese, then your population, yeah, is going to be specific to your clinic, and it would be fine to do it somewhere here like UAB. All right, so that's the participant voice piece that I was talking about. So what that means is that you have an expression of what they said usually within your reports, and also the researcher themselves provides their reflection on the research, and oftentimes discusses where they're coming from in terms of analyzing the research. So qualitative research comes from a theoretical assumption that there is no such thing as completely unbiased or completely objective research. And therefore, it is better for you to say, this is where I'm coming from, and this is my background, and these are the assumptions that I'm bringing to this work, and say that up front in combination with the actual research findings, than to leave that out. And I want to note, it's not like quantitative research somehow, is objective. It's not, because when you put together a questionnaire, when you put together a survey, there are lots of assumptions that go into that. However, the researcher just doesn't do that process of saying where they're coming from. So it's a really different way of doing research than quantitative. We can talk about that more in depth later if you're interested. So in terms of the purpose of qualitative research, you're usually trying to examine complex phenomena and understand something in depth about the human experience. And oftentimes it's used to shed light on quantitative findings. So sometimes it's the case that you have your survey data and you're not sure why you have a particular finding, and when you look at that open-ended question, it sort of makes clear why it is that folks answered that in a particular way. So we should use qualitative research when the issue that needs to be explored is complex, it's detailed, and to share stories and amplify the voices of the communities that we're studying. And I say amplify and not give voice to, because communities have voices. This is about giving a microphone to the community, and this is a really important one. And sometimes that a piece that doesn't jive well with the with clinical practice, that qualitative research fundamentally believes in minimizing the power imbalances between researchers and participants, which is why it's good for the physician to go out into that community, regardless of how convenient or inconvenient it is, because then you're setting a level ground. Then you're saying, I'm coming to you because I'm interested in your perspectives. And traditionally, that's just not how medicine works. There's an expert, there's someone who's not an expert, I tell you what to do, you go off and don't do it. Like, that's just how medicine typically works. So there is going to be a tension oftentimes between qualitative research and public health. Yeah.
I'm concerned. I've conducted focus groups in communities, in-depth interviews, and phenomenology, and I'm concerned that I'm getting ready to write up some findings from a mixed method study, sequential, quantitative, qualitative, using focus groups with veterans.
Okay.
But I did it in a sort of natural setting, the VA hospital.
Okay.
And I hope I don't get paid for that, because it was more of an issue of convenience. So I only got veterans who received care through the VA. And then on top of it, I have to bracket and note that I am a veteran.
Right.
I'm just not an older veteran, and I was truly interested in their perspective. So I'm concerned about those issues. So when I publish it. or try to
right.
get it published in some of the qualitative journals because of the purists. They scare me.
It is not unusual to talk with a specific patient population in the setting in which they get care if you're trying to only generalize the findings to that specific patient population. So as long as, in your write-up, you don't talk about veterans in general, but rather you talk about these focus groups with that patient population from this particular VA, you should be fine. And then in the limitation section, you say, oh, and by the way, this is probably not generalizable to all veterans because it was a very specific patient population that was getting care at the VA. And you also explain
and I'm a veteran.
Your role.
Okay.
Mm-hmm. Yeah.
In the limitation section.
No.
No? Oh, in the beginning.
In the beginning.
Okay.
Yeah.
Okay.
Yeah. If you have brought some sort of methodology along with that, so for instance, ethnography, then you can put that in your methodology section as well, but it typically goes in the introduction. Yeah.
Okay. Thank you.
So qualitative research is about understanding context and settings, and oftentimes it's used to develop theories. So let's talk about approaches to qualitative research, and you already mentioned one of these. This is one way to categorize the approaches to qualitative research I want to emphasize. So this is how Creswell does it. This is not the only way in which folks categorize the different ways of doing qualitative research, but I find it useful, and it's a good way to kind of get a broad overview. So first, narrative research is the type of research that elicits stories and then tries to identify patterns within the particular cases. So an example of a question that you might take on with narrative research is, what led you to study medicine among med students, right? And then it's possible that as you start talking to med students, you start identifying a story where you find that some of your med students will say, well, I had a parent or an uncle or a grandmother who was a physician, and that really inspired me to want to become a physician. And then it's possible that then you also hear from some other of your participants, well, I had a close family member, or I had a health crisis when I was really young, and that inspired me to become a physician. And so you're identifying stories within each case that then you can categorize. So phenomenology attempts to understand the lived experiences of a particular group. So, for instance, a question that you might want to tackle that way is, what was it like to provide emergency medical service to the victims of Hurricane Maria? And which you could ask of EMS workers, right? And phenomenology is all about trying to examine the lived experience. So you would ask questions like, what were you thinking? What were you feeling? How was that like for you? To try to really access what that was like. Grounded theory is one of these very purist and inductive ways of doing qualitative research. And it's all about developing a theory. And what you do with grounded theory is that you're supposed to go into the field with a blank slate around a particular topic, gather your data, and then analyze, come up with a draft of a theory, and then go back out and see if your theory worked, if when you show it to your participants it makes sense, or they say, no, that's not really how it works, and then you go back and refine it, right? So a way that you might a question that you might use grounded theory for is describing the adoption of new teaching technologies in medical education, for instance. So you would want to talk to the dean of the medical school and to med students and to faculty and so on. Ethnography, which we covered a second ago, is the study of culture, society, and worldviews through participant observation. Ethnography is typically what anthropologists do. That's when you go out and live in your host community. You're living in the field with the folks that you're interested in learning from, right? So one question that you might want to understand this way is understand how and why patients use alternative and complementary medical treatments in rural communities. Ethnography is really time intensive. It's really, it takes a really long time and a lot of effort. It's a really intense way of going about qualitative research. But it can be really useful because there are some things that you will just simply not learn unless you're experiencing that particular setting yourself. Then finally there's case study, and that's oftentimes, you know, what folks in the medical field or clinical work are most familiar with, which is just an in-depth study of one particular case. The reason why one case can be important is if it's really illustrative of, you know, a set of things that you think might apply to other cases. So something that you might publish on or do a case study on would be treatment considerations for a couple where both partners are diagnosed with diabetes. In that case, it's a dyadic case study. So you have two people, but it's one case, right? All right. So overall, you can summarize data collection methods as these four broad categories. Interviews, focus groups, observations, and textual analyses, which is when you go in and analyze documents or text of some other sort. So we're going to go through each one of these. So let's talk about interviews. A qualitative research interview did you have another question? I'm sorry. I thought I saw your can last between 30 minutes and several hours. Usually, they're best suited for capturing really rich and detailed personal perspective. Of course, you can conduct them in person, by phone, via Skype or FaceTime. In person tends to be the best in terms of getting in-depth data, but there are lots of different ways that are valid to do qualitative research interviews. When you do qualitative research interviews, you go in with a semi-structured topic guide. So we don't, when we're talking about qualitative research, we don't say survey, we say topic guide. And your topic guide for a qualitative interview that's going to last about an hour usually doesn't have more than 8 questions. So they're open-ended, broad questions. You never use yes or no questions, for instance, to get the subject talking about whatever experience that you're interested in learning about. Usually with these topic guides, when you start doing your interviews, when you start piloting your instrument, you'll go into the field, and I can guarantee you, I have been doing this for almost 20 years, like there is going to be one question, maybe 2, that don't work. Like it doesn't matter how hard you try to make it perfect. When you go to pilot it, people are like, well, I don't know, and it just doesn't, and it just doesn't get them talking. It just doesn't work. So you have to shift what that question looks like. So it's very common to do a couple of interviews, shift your reframe your questions in your topic guide, and then go back out with that version 2. And usually by version 3, you're fine. You don't need to change it anymore. The other thing about that is that you typically don't know what the correct probes are for a particular conversation. If you're having like this broad conversation, then it's sometimes you don't know what to ask. So that's why it's important to tailor the instrument as you go.
Yeah. Doesn't that introduce the bias though? Because as you go, you're just modifying it, and by the time you're in, compare the first to the last group, it's, you know, maybe you got the different answers because of the way you ask the question.
That's not how we think about it in qualitative research, because it is the nature of human interaction that things are biased, you know. So so you just go in trying to examine a particular perspective, and if you feel like you're not getting at what you're trying to get at, if the person's not accessing cognitively like the construct that you're trying to get them to access, then then you have to shift that wording. Now, you're not going to shift the entire conversation. You're not going to introduce new questions. So if you were talking about, you know, your experience going to the pediatrician, you're not going to all of a sudden start talking about, you know, your experience, going to the gynecologist. You're going to stay within the realm of what the original topic guide is.
But
now,
how you ask it, you might, you know, get different answers. And just even in the same topic.
Right, so like
That's-
going through, you change the way you approach the question, and if you use that question from the beginning, you would have had different answers from those who you interviewed before you alter the question. So
right, which is why when you actually report on these findings, you are not going to mix up the people in that first interview with the people in that last interview. So it's usually, that's why you pilot, right? To get it really strong within the first couple of interviews, and then the questions that you didn't shift, you can look at the entire sample for, and then the questions that you did, you look at that particular subset.
oh, so this is just a pilot.
Yes. Yeah. So good questions. Yeah. Of course. Okay. So let's talk about how you actually get data from this. The way that you get data from interviews is that you tape them and then have them transcribed verbatim. So your data are going to be Word documents. Like, it's going to be a transcript of that conversation. The major limitation with interviews is, of course, that they take a lot of time and resources. So there's the prep where you put together your interview packet, then you go out into the community, you actually conduct the interview, you come back, you immediately have to write up your field notes as an interviewer. So there are a lot of things that are not going to be captured in the recording that you need to take note of. So for instance, if the person was checking their watch all the time because they had to pick up their kid, like, that's something that you want to capture just to have it for context later on as you're analyzing the data. And it's really important that you capture that right after you do the interview. So it takes about 3 hours to do like a 1 hour interview. Yeah.
I agree. It is immensely intensive. I have a question about transcription, verbatim. I've done it, and do you recommend giving the interviewees copies of the transcripts for, I forget what approach it was called. Was it for validity or whatever? And I found that sometimes they don't like it because they see the poor grammar and all the humming and that they've done, and they just don't like it. And so I've had to present them with their transcripts. So now I don't know what to do, because some of the literature says, you know, be transparent, let the participants read their transcripts because that heightens the validity, I think they said. But
it sounds like you're talking about member checks. Yeah.
So I don't know what to do. Yeah.
I don't typically give the transcripts back to the participant. So, what you're referring to is member checking your analyses. So, usually with qualitative research, there's different ways to ensure rigor and transparency. And one of the ways is to go, once you've done your analyses, is to go back to your participants and say, does this read true? Is this what you meant to say? I typically pull out the quotes that best illustrate that particular theme and show my participants that. I don't usually go back and do the full transcripts
Okay, that's good.
with them. Some folks, especially if you're doing CBPR, community-based participatory research, will analyze the transcripts with the participants. And in that case, you can do some capacity building around, listen, like, you know, see my parts are full of ums as well, and there are some things that you can do to make people feel more comfortable. All right.
Okay, thank you.
Sure. So focus groups are oftentimes used for qualitative research as well, and these typically last between 45 minutes and again several hours. You usually want between 4 and 12 participants. I find 6 to 8 to be kind of like the sweet spot where people are talking, but it's not too many people. 12 is really difficult to manage. 4 is almost not a successful focus group. 4 is really few. The reason why you do focus groups is to gather really rich and detailed viewpoints where you want group consensus, where you want to understand a group's understanding of this particular subject. So like we were mentioning before, sometimes we don't have cognitive access to why we do stuff. But then you start talking to someone about it, and it starts sort of gelling, and you're like, oh yeah, that happens to me as well. And so that's why focus groups can be helpful to approach certain topics. It also helps you get a sense of, you know, of what are common practices among a particular subgroup. Again, the way that you get data from this is that you audio tape it, and then transcribe it verbatim. I always say, if you are the PI on a focus group study, go to that focus group, and make sure that there's at least 2 of you there, because otherwise it'll be really difficult for you to tell who said what. It's almost impossible, like, when you get that transcript back. So if there are patterns, or for instance, you know, you went in thinking that men and women would be the same on this construct, so you put them together in this focus group, but then as people are talking, you realize that there might be patterns. You don't want to accidentally categorize someone incorrectly because you weren't there. Yeah.
Yeah. So once I helped organize a focus group, and one of the eligibility criteria was that you shouldn't have had bariatric surgery. In spite of asking that, we had 2 participants who actually did have surgery, and it wasn't until, you know, the middle of the focus group that, oh yeah, and I had. And so what do you do at that point? You know, have they already contaminated the discussion, and this is a one-time thing? You cannot just say, okay, everyone. How do you deal with that?
Whew, I mean, you have to throw out that focus group, unfortunately. I mean, or you can do an interesting lessons learned paper about it, but but yeah, basically, because you never want folks who didn't meet your eligibility criteria in your sample.
But I feel like you get so much more information when you're at the focus group than people might, you know, whatever financial reasons they may have to want to participate, if they're not forthcoming about it, and yeah.
I know.
Does that happen often? That was my N1 experience, and it didn't go well.
I have not had that happen to me very often, no. But community-based researchers don't pay that much for their incentives. Like, you know, the most that you're getting is like $50. So so then you don't have that oftentimes where folks are like so compelled to lie about their eligibility criteria. I'm surprised that they told you. I'm surprised that they were like, no, actually, yeah.
Yeah, we had, and my state coordinator, yeah, she went through, you know, that was one of the questions qualifying, so I don't know what happened.
That's a really tough situation, because you can certainly say, well, thank you so much for being here. You're actually not eligible for this study.
Right.
Bye. But yeah, it's really challenging. It does happen. Yeah. So like I said, usually you want 2 people when you're facilitating these things. One's the facilitator and the other one's just taking notes. And the notes piece is for 2 reasons. It's, first of all, to gather certain context pieces, or, you know, so sometimes people will have an expression on their face, and or there will be I don't know, a beeping sound in the next room, and there are things that you want to be able to capture that are difficult to get from the transcript, and you want that for context as you analyze. And the other reason is because sometimes audio recordings get erased accidentally, and it's the worst. for qualitative research, it's okay to analyze your notes. It's a limitation, of course, but there are methodologies for actually doing content analysis on your field notes. So it's a good thing to do so that you just don't lose that completely. All right. So next, there's observations. And this is when you study participants doing their regular things that they do, and you are just sitting there observing those interactions or that behavior. It's really good to examine procedures, to examine interactions between people, and in the case of of looking at meetings, for instance, of trying to examine decision-making processes. And the way that they teach you in grad school to do observation, has anybody ever done observation? Yeah, is to take your piece of paper and draw a line through the middle of it, and on one side you do verbatim notes of exactly what's going on. Like you try to write down everything that people are saying and everything that's going on, and then on the right side you write you timestamp and you write your own perceptions and your own reflections on it simultaneously. So I hadn't done observation in years until recently. And then I had the opportunity to do it just a couple of weeks ago. And I remember how much I like it. It's actually a lot of fun. So have y'all heard about the Medicaid waiver, the work waiver that Alabama Medicaid just put into CMS? Anybody? Does anybody? Yeah. So at UA, I am part of a program evaluation team that works with Alabama Medicaid to evaluate the effectiveness of some of their programming. And as part of that work, I was asked to go to a public forum where Alabama Medicaid was talking about this work requirement waiver that Alabama has put in. So essentially what it says is that if you're on Medicaid, you have to work a certain number of hours a week to remain eligible for Medicaid, and essentially if you get another job, then you fall off. Lots of folks have written opinion pieces and policy documents on it, and it's a tough policy because it's going to kick off a lot of really low-income families from Medicaid. Yeah.
I'm confused. So you went and did an observation
of a community forum where
community forum.
Yeah.
For Medicaid.
Where Alabama Medicaid was taking public comment on that policy that they had just put in for to CMS, to the federal agency. Yeah, so it was at the Hoover Library, and there were like 100 people there, and they took turns going up to the podium, and everybody was against the policy. No one was for the policy, and they gave their reasons for why. So so I went in there with my little clipboard and sat in the back, and I took verbatim notes of who was going to the podium, what they were saying, whether people on the right side, and people clapped, and and the room went silent, and so just to try to capture everything that happened in that exchange. And later on, those notes are the data.
Do you tape record observations, or you can't because you got to let people know they're being recorded? Mm-hmm. So you just...
Mm-hmm. Yeah, okay. And then later on, of course, if we were to publish this, we would, it is a public forum, so there was media, so it's not like there's any expectation of confidentiality. Okay. But we would still remove the names of the specific participants who were speaking if we used quotes. Wow. Yeah. Of course, the limitation of this methodology is the participant effect, because you will never know if you being there had an effect on the way in which that behavior or that event that you were observing, if that would have been different, right? So I think with this particular example that I gave you, I sat in the back. I didn't say anything. I wasn't like shaking or nodding my head. I was just quietly writing down notes and observing everything. So I think that participant effect was pretty low for that one. However, if you're trying to study parallel play among kids and you're sitting in a daycare center trying to look at that, they're going to come up to you. They're going to want you to play with them. They're going to want you to pick them up. So, so there's going to be a strong participant effect for something like that.
What about the TV cameras?
Right. Yeah. That's and there's actually a good amount of literature on that, on like where you place the recorder when you do one of these data collection methods. That if you place it like right in front of people, usually they're a lot more self-conscious than if you put it to the side or so. Yeah, absolutely. The devices, that just really anything can have an effect on what's going on. Next, there's textual analysis. And textual analysis is really good to gain insight into a specific content area for which there's already a lot written. So examples of content analyses include systematic reviews of the literature, policy analyses, program evaluations, open-ended questions you can do textual analysis on. So if you have a survey and you have a good amount of textual data that came from that survey, you can analyze that, and that's a perfectly valid qualitative data collection method. The limitation with textual analysis, of course, is that you can't ask your documents questions. So if you're interested in trying to learn something and then you go in and it turns out that your documents, don't have the information that you were hoping that they had, you're going to have to do something else to get at those data. All right, so next, I just want to walk through the steps of doing qualitative research by providing an example of my own research. So I'm not going to go through each one of these methodologies with an example. I'm just going to focus on one of them, which is interviews specifically, but it'll give you a sense of how qualitative research sort of unfolds and what you need to do, right? So the steps for qualitative research are just like quantitative. You develop a research question, then you choose a qualitative research approach and data collection method. 2 and 3 actually usually happens simultaneously or iteratively. It's not usually one and then the other. But that's, I just wanted to point that out. Then you develop your protocol, get IRB approval, do your data collection and analyses. Again, these happen at the same time. Write up reports, go back to your participants and do member checks to make sure that you got those analyses right, and then you disseminate findings. So let's go through an example. All right. So in developing a research question, you got to start with a topic that you're interested in, right? And the first thing that you want to do as soon as you think of a topic is to look at the literature on it, because even if it's something that you deal with in your practices every day, that doesn't necessarily mean that that you've read every last thing that's written on it recently. So so start with the literature, then talk with mentors, colleagues, and other stakeholders to get a sense of what you might be missing, and then you can draft your research question. In my case, what I was interested in was sexual health disparities among adolescent Latinas in the United States. So we know from EpiData that adolescent Latinas in the United States in general and in the Southeast in particular are disproportionately affected by unplanned early pregnancy and HIV. So I set out to do a systematic literature review, that's a textual analysis, to get a sense of why that was the case. So that's the paper that you're seeing there that I published on. In doing your review of the literature, you do not need to do a systematic review. This is how I did it because, I had a fellowship here and had the opportunity to do this. But there's no need to go that deep into it, especially if it's a subject that there isn't that much data on. So the research question that I came up with after doing the systematic review of the literature was, what are the barriers and facilitators to sexual health care access among young women in Alabama? So in doing this work, it became clear to me that these young women were not intersecting with the healthcare system in an effective way. So I set out to try to find out why that was the case. All right, then it came time to choose a qualitative research approach, right? And in trying to, and this is not exactly, just to be transparent, this is not exactly how I did this because I've been doing this for a long time and I knew exactly what I wanted to do, but but this is a good tool if you're starting out with qualitative research to figure out what kind of approach you want to use. So ask yourself, am I trying to gather and understand people's stories on a particular subject? In my case, I wasn't necessarily trying to understand so much their stories as their experiences. Am I trying to understand their lived experiences and constructions of those experiences? So yes, it was phenomenology. I wasn't trying to write a theory about it. I certainly wasn't trying to do ethnography because as a researcher, you can't be in the examining room with someone trying to access care. And case study wasn't going to be effective for this either. So phenomenology was really what was going to work for this. Now, just to make sure that I give you just the full nuance of what this of what qualitative research is. So although this work is primarily phenomenology, there was one question in my topic guide that was narrative research. So we were interested in trying to understand the stereotypes and the things that young women hear from their communities and from their classmates and things about being a Latina in the U.S. South and this thing around unplanned early pregnancy. So we did ask, tell me about a time that someone that that was your age became pregnant. What happened? Tell me that story. And we did get some interesting stories around that. And some of the concepts that came out, for instance, were my participants were second generation or 1.5. So they feel like they're Alabamians. They have been here for a long time. Most of them are either citizens or have DACA. So then so the story that came out with that particular question was kind of like this us versus them thing, where they were talking about how, well, yeah, that does happen among us, but that's not me. That's these first generation adolescents that are, that are getting pregnant and things like that. So, so although it's primarily phenomenology, there were other pieces as well, and there's even an ethnography aspect to it because my postdoctoral fellow is an anthropologist, and she's lived in Tuscaloosa for 10 years, and that was her field site for her PhD. And she went to Tuscaloosa with the intent of understanding what it was to be someone who was Latino in Alabama during that time, and then the tornado hit, and then HB 56 happened. So her ethnographic work kind of shifted to reflect that. So that means that when she's approaching this work, she writes these really detailed and nuanced field notes that contextualize the data as well. there's ethnographic work that goes into it as well. But primarily it was phenomenology. All right, then in terms of choosing the most appropriate research methodology, I knew that I wanted to do interviews, but I had a mentor who was set on the fact that focus groups would be better for this, and she thought that I should do like a chat room type of situation, and that it would be really interesting and innovative. And I just thought that young women would feel a lot more comfortable talking one-on-one with someone about their experiences trying to access healthcare, especially reproductive healthcare services. So, I convinced her eventually, but we ended up going with interviews. So after that, you have to write out your research proposal, and I wrote this up and submitted it to, I think, 3 or 4 different funding mechanisms. I finally did get it funded about a year and a half ago now, and have been conducting the work. The writing of grants and research proposals for qualitative research is completely outside of the scope of this conversation, but I'm more than happy to discuss in more detail if that's something that folks are interested in. And how many of you have done an IRB before? Okay, yeah, so we're not going to go into a ton of detail on this, but you have to include all this stuff for your IRB. So the lay summary, the study procedures, how you're going to protect your subject confidentiality, and then sometimes folks are really surprised to find out that when you do your IRB, you need to have everything already written up and submitted. So all of your study documents, and then all of it in Spanish if you're doing a bilingual study. Then it's time to collect your data and conduct analyses. In terms of participant recruitment, the way that we did it was community-based, purposeful convenience sampling. So it's very common to, once you've already done a study, to go back to that cohort and say, do you know anybody else who would be interested, or see if there are eligible folks in that person's social network. That's kind of the approach that we took with this. So because my postdoc had done previous research at the community level in Tuscaloosa, she was already well known. She was trusted by the community, and we primarily talked to the kids of her key informants for this study. When I say purposeful convenience research, is that our recruitment, what I mean is that we're trying to tick off certain boxes, right? So at the beginning of the sample, for instance, we noticed that it was skewing like really young. So we were getting a lot of 15 and 16-year-olds. So then we started purposefully like trying to make sure that we were getting 17, 18-year-olds as well to get those perspectives. Of course, with this kind of work, if someone is under 18, they need to get parental consent. And then the kids give assent. And then you go out and you do your data collection. When you're choosing a transcription company, it's really important to make sure that they're human subjects trained. My experience with transcription companies has been really varied. Some of them are really strong, turn around things really quickly, and others are not. And usually when issues come up, it's oftentimes around capturing data well. So you want the person who's transcribing your interviews or your focus groups to be willing to go back and listen to a piece again, and and make sure that they're getting as much of it as they can. When there are big gaps in your transcripts, it's really frustrating, because you've gone through all of this work to get your data, and then someone just puts not audible, and so it's really important that you check on those. Next, it became time to analyze the data, and like I alluded to before, with qualitative research, you conduct the data collection, you analyze, and then you conduct the data collection again, and you analyze. So just to make sure that you're not missing anything. That's particularly important during the piloting phase, because you don't want to come to the end of 20 interviews and find out that a certain question that was really key to your study was just not working. And then this is what your data look like. They are transcripts. In terms of rigor, the way that you ensure rigor in qualitative data analyses is by keeping a really detailed audit trail. An audit trail just means that every time that you make a decision about either in the piloting phase shifting the actual questions or changing your coding scheme, you have to make sure that you're capturing that and that you're maintaining very detailed notes about why you made that decision, usually with your other coder, because that's another important piece. With qualitative research, you generally want at least 2 coders to have consensus on the themes that you're seeing in your data. Some folks go as far as to do inter-rater reliability, which is where you compute an alpha coefficient of the degree to which the 2 coders agree on how the data are coded. If you use NVivo, which is a data management and analysis software, you can simultaneously code with your other coder, and then it'll do it automatically, which is kind of nice. And then the other piece that we alluded to before are the member checks. Once you have done your analyses, in qualitative research, it is crucial that you then go back to your community and say, did we get this right? Does this read true to you? So when you're analyzing the data, what you end up with is kind of like this outline of themes. There will usually be, a group of big themes that you're that you're seeing, these sort of parent themes, then the sub-themes, and then the actual codes. And we can talk about data analysis in more detail as well later on if you guys are interested. All right, and then after all of that, you finally do have results. So in this particular study, we had 20 young women who self-identified as Latina, were between 15 and 20 years of age, and had been in the U.S. for 5 or more years and lived in West Alabama. 65% identified as Mexican, 60% had health insurance, just to give you some context. And then this is what the data actually looks like for this study.
Before you move on, how did you come up with the number 20?
We didn't come up with that number. It was that we reached theme saturation by that number. That's a really good question. So I actually thought that we would need to do 30. I had planned for 30 interviews. The way that you decide that you can stop doing data collection in qualitative research is when you have theme saturation, when you have when you are no longer hearing new things about your research questions when you analyze the data. So typically, if you have 5 or 6 people that say a particular theme, then you can feel pretty confident that this is something that's emerging and that's important in this sample. Once you get to a point where everything can fit neatly into the coding scheme that you have, and you're not hearing anything new, then you can say, okay, we have reached theme saturation. So I just pulled out some quotes from one of the particular questions that we asked as part of this study, and this is one of the themes that emerged. So we asked, if you were in a room with students learning how to be doctors or nurses, what would you want them to know or consider when treating young Latina women? And one of the things that they talked about was really entirely about being an adolescent and not at all about being Latina. It was about asking to talk privately to their provider. Yeah.
What are the numbers in the brackets for you?
It's just the interview number.
Okay.
Yeah, I like to keep track whenever I present the data. Yeah. And yeah, I mean, I guess this is pretty similar for quantitative research, but the naming convention that I use is that the first number is the type of data collection. So 1 in my case were the young women, and then the second 2 numbers is the actual number of the interview. So 120 is interview number 20, and then the one it specifies that it's young women. So when we talk to community stakeholders, they were 2s. We talked to providers, they were 3s, and so on.
Thank you.
Yeah. Another thing that came up with regard to this, another theme that came up was considerations with regard to culture and language. So yeah, so one of the young women said to maybe consider learning Spanish as a consideration. And just let you guys read through or skim through that. All right. And then lastly, before we go into doing the little exercise that I have, I just want you all to read through these quotes and tell me how would you categorize this? What theme do you think goes in there? Or is it the case that these are not all the same theme?
Like compassion.
Mm-hmm. Provider compassion, yeah.
And empathy.
Empathy. Mm-hmm.
But that's kind of like general, I feel. It's not, I mean, that's general patient expectation.
It is, and I haven't pulled out the pieces about
Respect.
yeah. I haven't pulled out the pieces that are specific to the subpopulation about negative experiences with providers. So they say things like, they don't treat you well because you're Mexican. I had a doctor made me feel badly for being sexually active. She asked me about my boyfriend and why I even had a boyfriend. So yeah, no, I agree that this is not like headline news, but I think that this is one of the first studies to look at this particular subpopulation.
And in this study, did you also assess who the providers were, what their background was? So did they really matter if it was a female or Hispanic person?
Mm-hmm. Yeah, they talked about that. We didn't go out specifically asking about provider characteristics. We asked that specifically about who they wanted to do a sexual health education intervention, for them, who they would feel comfortable talking to. But yeah, they told us a little bit about that, and the consensus was that it didn't matter. They didn't necessarily feel more comfortable with women. They just want the providers to be patient with them, to explain things to them, and to not make them feel bad for being young women who were sexually active. Yeah. All right. So then finally, the last piece is actually presenting your study to participants and other research partners. So this is different than member checks. Member checks is actually going back and making sure that you got the analysis right. After you're done with that, whenever you work with a community with qualitative research, and really with quantitative research too, but I think qualitative researchers tend to be more adamant about this. The sense is that you owe it to them to give the findings back, to then have community forums, to then have to send them the report in lay language, so that folks can know what they were a part of. So that's a really important piece, and that's not only to your participants, but that's also to your community partners. So if you worked with a nonprofit organization or with nursing staff or with another set of key stakeholders in collecting your data or recruiting your population, you want to go back to them with those results. I tend to start by doing informal peer presentations. So I have, for instance, a national presentation of this work coming up next week, and I'm going to present it earlier in the week informally to my colleagues, just to bounce off it, because it's the first time that I'm presenting this particular part of the work, just to make sure that we can together figure out what questions I can expect and things like that. I usually go from informal to then conference proceedings and then finally manuscripts for publication. So those are my references, and that's really it. What other questions do you guys have?
I have a question. So something I always think about is, it's kind of, when you're doing these studies, some of it is obviously opinion-based, based on the participants, and then, of course, because, it's so time-consuming to do a large number, or say you reach saturation, how, when you're talking about generalizability of findings like this, and these samples are so small, and I know that in terms of qualitative it's not small, but, how do you account for that to kind of say, like, we can generalize this to other populations when you have these things that maybe come out? Because I always wonder, say maybe this particular group, maybe in Alabama, might kind of have these feelings, or maybe like 10 out of the 15 had that opinion, but maybe, the other ones did not. How do you, I don't say make it meaningful, but like present that in a way that shows that truly could represent a larger portion of the population?
Mm-hmm. The purpose of qualitative research is not to generalize to the entire population. The purpose of qualitative research is to better understand a particular subpopulation within their specific community context. So with this particular study, I wouldn't even necessarily generalize it to young Latina women living in Birmingham, because there are so many more resources. So Birmingham, has a lot more adolescent-focused healthcare services, and has a lot more Latino-focused healthcare services. So this is very specific to this community living in Tuscaloosa County, Alabama, and if you remember, if you go back to the first slide, and the reason for that is going in with the assumption that in order to create meaningful community change, you have to look at this granular, at this granular level, at this kind of like very specific community-based level. So, the findings from Youth Risk Behavior Survey, for instance, are not going to necessarily be generalizable to Tuscaloosa County, Alabama. You know what I mean? So no one else is looking at this particular subgroup in this particular community. So this is about, so the work is about trying to figure out what we can do specifically for this community. It's about social change and programming and partnering with communities to create meaningful programming at this level, if that makes sense.
Do you ever build upon that? You've got this one very small micro community, then kind of keep moving up to, or is that not really happening?
Sometimes. So yeah. So the next piece that I'm going to present next week at a conference is actually taking the other pieces of this data collection, because we triangulated. So we didn't just talk to young women. We talked to providers, we talked to parents, we talked to community stakeholders, and I have created a conceptual model of how I think, context affects the context of, of West Alabama, affects healthcare access for this community, right? So, so then that's something that then I can take and try to scale up and do a quantitative study on to see if it holds true for, say, Alabama. Or there might be specific pieces. So you can. What is more likely and what happens more often is to take this work and then apply it to other communities that are similar across, the Southeast. So other like non-urban centers, like Tuscaloosa County, Alabama, and like South Carolina or something. Yeah. Mm-hmm.
You mentioned triangulation. For those of us who are not familiar with it, can you just briefly?
Mm-hmm. Triangulation just means trying to examine the same social phenomena from different perspectives. So we ask these same questions of parents, of providers, just to see what things held true between those groups and to get the different perspectives. Yeah.
I think qualitative research is really fascinating and could help, guide interventional studies where, adherence may be an issue. But for someone who doesn't have a qualitative research background, how do you go about maybe collaborating with someone who might be interested in me? Because it seems like, learning how to do this whole thing would be maybe more complicated than
no, it's
coding and also analyzing data and developing a study guide, but yeah.
Yeah, I think that you're right. I think that most folks who are in clinic all day are not, and unless you have like a certain amount of your time that's bought out to do research, it's really challenging to actually, especially by yourself, like implement a qualitative research project because it is really time intensive. So absolutely, you partner. So for instance, I'm working with Dr. Simpson and Dr. Hill with regard to adolescent health and PrEP right now. So they are working to pull together a grant that's going to hopefully fund the provision of PrEP in the adolescent care clinic. And I am their behavioral person. So I'm going to be tasked with doing the qualitative piece of it and doing focus groups, and then I bring my resources, so my postdoc, my students, my research infrastructure that I have at UA to that study. So you just
There's no clinic like the biostatisticians, or you just have to sort of contact the person individually and see if they're interested.
That's a really good question. No, there isn't, but that doesn't necessarily mean that you couldn't tap into programs that already have folks who are doing this work. So it's not a bad idea to, if you're interested in this sort of thing, to look at who's doing qualitative research in the School of Public Health, to look at the School of Social Work or the psychology department, and these are fields that do a ton of qualitative research, and see if they have a graduate student who would want to work with you. And that is, that's what graduate students do. Their time is protected to do this kind of research. So that's a really good way to make that happen.
The School of Nursing does a lot of qualitative research too.
That's true. Yeah.
Sort of two questions. One more general. For identifying a qualitative research study in the literature, are there certain buzzwords besides qualitative research, or you just sort of, once you see the study and read the article, you just sort of know based on the methodology and the questions that they're asking, that's what it is?
Usually qualitative will get you what you need. Okay. Usually as a keyword, qualitative will get you what you need. If you're looking for a specific type of qualitative study, you can look at that. You can say, narrative research, but I don't usually have a problem finding qualitative studies. What's more difficult is to identify studies where they've used mixed methodologies, because sometimes they won't put it clearly in the title.
Then the second question is more related to textual analysis. Would you say that's sort of frowned upon in the field? Because it's better to do it in person?
Not necessarily. Not necessarily. I think that systematic reviews of the literature are kind of having a moment right now, and everyone's kind of excited about it because more recently, so people for a lot of years were just writing reviews of the literature and saying that they were systematic reviews of the literature, but there were no guidelines for what it meant to do a systematic review of the literature. Now there are, and and Prisma is what most folks use, and CDC has its own set of standards, and it's data extraction based on a framework method. So you plug information into this massive table and do it in a very systematic way so that you have rigor and transparency, so that you can take your analyses and show them to someone else and have someone reproduce them. Yeah, so not necessarily. Yeah, I think that maybe things that that are considered more white papers, like policy analyses and things like that, if you're trying to go up for tenure, some departments might not rank that publication as highly necessarily, but it really depends. Okay, so with our remaining time, I think that most of you have this, right? So I just want everyone to take some time to think through a qualitative research question that you may have in mind, or maybe you've never thought about doing qualitative research, but to sort of think through what it would take to do a qualitative research project. And this is just a little exercise to help you think about the considerations that you need to keep in mind in pulling together qualitative research. So if you want to take like 10 minutes, and then we'll discuss.
As soon as you came in, I was like, thank you so much.
Oh, absolutely.
Yeah, you working with me now,
With Tina.
Tina.
Yeah, she's a pediatrics.
She's in pediatrics. Okay. Yeah. PhD from school. Back in 2015, I came for a presentation that the Association had.
I remember, yes, with the Latina.
Yeah, Latina tolerance. She's up in New York, Pennsylvania. Talked about me weekly. You know, it's just she graduated from UA. She does, content analysis. Yeah, so nothing really much come out of that. Yeah.
Oh, I'm sorry to hear that.
So, let me see. Looks like you got your grant, so congratulations.
Thank you.
And I love crossword. These books are so simple.
Exactly. It's really straightforward, especially after training with Lincoln and Gruber.
Oh my gosh. They give me a headache. They just make it so complicated.
Yeah.
It's not necessary because making that great. They just spend way too much on it. Well, good to see you.
Good to see you.
I already have 2 studies, so.
So you're good. Yeah, I mean,
It's hard. It takes a lot of time.
but you know, it really, helps you get at things that you can't get quantitatively.
Research, CCP's gave me some money to finish the master 27 interviews.
Oh, good.
I wanted to start at 12. I had reached saturation of my mental. It's just.
That's not necessarily, right? You can publish with quality have saturation. It depends on how complicated your question is.
It wasn't that complicated, but they made me, postdoc. I just went ahead and did. But I was just like, at 27, I stood my ground. I said, look, this is ridiculous. We're not learning anything else. It's the same things. So I was like,
Sometimes mentors just want you to do what they want you to do.
I know they had 30, but they're not qualitative researchers in either mind. I prefer to let the question dictate what approach I'm going to use. They just had that dirty in their head. They just couldn't budge. So after 2 years, they budged. I was going crazy. I was on the phone with Dr. Pay. It was unnecessary. So, trying to push it and sucking those times. I didn't listen for the panty and the border editorial. There's something just purest. Always carry. She's not a qualitative researcher. She goes back and forth.
Did anybody listening from elsewhere have any comments or anything? Okay. Did we have folks on that?
They're quiet today. Thanks for your email.
How many did we have?
At one time we had 23.
Okay. Yeah. And today?
Well, we had 23 today. We're down to like 17, but there's still some.
Still a lot.
Yeah. Well, folks online.
just stressing me out. Because I'm trying to write up my qualitative findings. 2.5 years. It's just too much. So, I'm going to finish. Somebody transfer. I try to avoid a qualitative question when you're playing. I really crunch to data analysis. Have you done qualitative work? My undergraduate thesis was on sexual practices of college students. It was just transferred.
All right, so that was about 10 minutes. Thank you to those of you who stayed. Who would like to share what they came up with?
How do you want us to do this? Lauren, how do you want?
Well, I just wanted you to look through and see if you could come up with a qualitative research question and then
Okay.
propose an approach and a methodology.
Okay, I have an area of interest that I'm currently not working on, so I'll make it a little easier, harder for me. Birmingham is becoming an area with a large number of cycling enthusiasts.
Mm-hmm.
And I notice when I cycle, there are a lot of older cyclists. I mean, 60s and 70s on road bikes and a lot faster than I am. So I've become intrigued with why they still do this at their age. So I want to do, I'm thinking phenomenology
Lived experiences.
for their lived experience, or either a narrative research. I'm not sure, but I think phenomenology more so because I will be able to really, I think, bracket or put aside what I'm feeling and what I'm doing and trying to separate myself more, or maybe it's because I'm more familiar with phenomenology than I am narrative research, so I don't know which way would be the...
Well, it depends on what you're trying to get at. So if you're trying to understand why they got into cycling and you want them to tell you a story about a time that they, had a challenge perhaps when cycling in the city, then that would be more narrative. If you're just trying to understand, their lived experiences as a cyclist in Birmingham.
As an older cyclist, why do you still do this? It's crazy.
It's phenomenology. Yeah.
So it is phenomenology?
Yeah, the way that you're talking about it would be phenomenology. So how would you find these participants?
Well, let's look again. I'm in the cycling community, but I would hang flyers at the different bike shops. Bike links, Kava cycles, and then there are group rides throughout Birmingham during the week. So I will hand out flyers, and then the bikes part of me, I know a lot of the older cyclists, so so it'll be kind of problematic.
Not necessarily. It depends on what you're trying to understand and how. I think that if you are extremely familiar with the community and you're doing, then you would probably want to probably recruit yourself, but then
I wouldn't qualify.
Have a co-author do the actual focus group or interview if you think that relationship with you
would influence that conversation that much. But it really depends on what you're trying to get at. But I think that would be interesting. What would be the end goal? Like, would you be trying to improve or like provide like a policy recommendation to the city of Birmingham around cycling and encouraging cycling, or
That would be great. But that's a great idea. But what I was thinking,
Like getting bike lanes, if we can show that a lot of
the bike lanes are a joke right now.
yeah, if you show us all of the distance of cycling and
parking is such an issue here. It
Yeah.
makes sense. Yeah.
But my whole goal of doing this, because physical activity tends to decrease as we get older,
Right.
and it's this myth among physicians that they can't prescribe physical activity to their older patients with comorbidities like 65 and up. So it'll be a chance to really show people that not just the medical, but the community, that there are older adults who do exercise, and they are a special population, and what will improve that experience for them to keep them, what will continue to bike lanes, like you said, that's really good. Bike
And
lanes.
there's a lot of literature on resilient populations. So, trying to capture the folks who are able to engage in health protective or health promoting behaviors, and see what things about them or in their context makes them able to act this way, so that we can then take what we learn and help others become active as well. So yeah, and the reason why I asked that is because like I said at the beginning, qualitative research is about trying to influence a social problem. So we don't ask questions simply because we're interested, but because we want to do something for the betterment of the community. Who else wants to do that too?
I have one.
Yes.
So I take care of patients with HIV, predominantly children, so perinatal acquired, and then I suppose some adolescents. But so a phenomenon that I am interested in is compliance. So I have a cohort of patients that I really struggle with compliance. And just trying to understand why, what are the barriers to taking the medicine?
Yeah.
So, where there's a lot of literature on it, but, pertaining to the specific patient population and the challenges they face, because we're such a centralized referral facility for the state, so, accessing us isn't so easy. But, they have the medicine, they tend to understand the disease, but they're still not compliant.
So what's going on there? Right, absolutely. So what approach would you want to use to look at that?
I suppose it's trying to maybe just the narrative research to start off with, right? Trying to understand from the family's perspective. It's, I suppose, where I would start. I'm not sure.
Yeah, I mean, and it would be children specifically that you would want?
Well, so it becomes complex, right? So your younger children are reliant on their caregivers to give the medicine, and then as you transition from young children through to adolescents, you have to transition that responsibility over to adults. But generally I find, or to the adolescent, right? But I generally find that if they're non-compliant, as when they're younger, it's very hard to expect the adolescent to start being compliant, taking the medicine. They've never been compliant.
Oh, absolutely. Yeah, it's almost impossible. I mean, and there's an association, as I'm sure you know, between being younger than 18 and being adherent to your medication, and it's oftentimes because you are under your parents' care and they're making sure that you do so. And then folks get lost to care oftentimes, and you have those pieces as well. So yeah, absolutely. You could approach that with focus groups. You could approach that with interviews to try to better understand why it is that that they're having this trouble in maintaining the viral load and low or undetectable and staying up on their medications. And when you look at the literature in this subject, it's oftentimes stigma. It's oftentimes that they don't feel comfortable like taking out their medicines, even with family members or at school. It's housing insecurity. So like
there's lots of factors, right? But still, ultimately, as the child, the child has no control over it. She's still reliant on the family member.
Mm-hmm.
I don't know, it's a very complex problem, so I'm not even sure where, but I think qualitative research is probably the best place to start trying to understand what interventions are put in place.
Mm-hmm. Absolutely. Yeah.
Given the subject matter, HIV, people who are HIV infected, do you think a focus group would be the best idea, or should it be more one-on-one, like in-depth interviews? I've done focus groups to learn about HIV transmission, how, sexual practices that increase the risk of HIV infection decades ago. So, but nobody's HIV status was known to me.
Mm-hmm.
But in this case, you already know that they are caregivers for HIV-infected children, so there's stigma associated with it. So would focus groups be the best approach?
It depends. Yeah. I mean, there's precedent for it, absolutely. Like, I think that if you can ensure people that their confidentiality will be protected, this is one of those instances where you go into the community and you do this at a community center somewhere, or a church, or the common area of an apartment complex, or wherever it is. You would want to reach out. There's absolutely precedent for it, and oftentimes what researchers do who are interested in talking to HIV positive communities or people living with HIV or AIDS is that they'll partner with nonprofits who already have support groups.
Okay.
And that tends to be.
Yeah, because I'm thinking, as the provider trying to do the interview, it's there's immediately a barrier, I think, that gets raised to truly get to the bottom of it, right? Because the participant always wants to tell you what they think you want to hear.
Oh, absolutely.
So you don't really get to the root issue. So getting at it from peers, I think, would probably be more successful.
Yeah, no, there's a big social desirability piece that goes into that, and we have a lot of studies with adolescents that show that people always overreport the degree to which they're adherent. So it's important to have some bio measures as well to make sure that you're getting what you need. Does someone else want to?
In the beginning of this CPS course, as a group, we came up with a topic that the caregiver burden is an important problem that can affect our patients' care. So I was thinking about that, and for example, I take care of patients with ALS, which is a very serious, and the patient's care sometimes gets very complicated when the caregiver is absent or caregiver gets burned out. I often see sometimes patients cannot even come to the clinic. So when think about that, we need to provide them with resources, but our resources are limited, and I like to know which resources are the most needed from the caregiver standpoint.
Mm-hmm.
So in that aspect, I think that qualitative research can be helpful. Maybe I can approach them and hear their stories and see if I can come up with a theme, see if there's different experiences that tell me the same thing. So yeah, I thought that can be interesting.
Oh, absolutely. Yeah, that would be really interesting. And And I think that you bring up something that's really important that I want to address, which is that when you're doing community-based research, it's important that we're thoughtful about what we are realistically able to provide. So, for example, one of my academic mentors is Dr. Isabel Scorency. I don't know if anybody knows of her work. Yeah, she does community-based participatory research around prevention of cancer, especially breast cancer and cervical cancer, with the Latino community locally, and which is largely, under or uninsured, right? So she does these big sort of community events that she's been doing for years and years, where she provides kind of like this this educational session, not herself, but another expert in this area, about the importance of getting screened, and then she connects them with a free screening opportunity. So lately there has been sort of this conversation going on in public health and community-based research about, do we want to go into the community asking these questions and then not being able to provide the resources so that they can do something about it?
Exactly. So I already know that they would eventually need transportation fees because they cannot drive. I know they would need help at home with dressing, bathing, and cooking. They would definitely need financial support because they're not working anymore. But I really don't know which one should be the priority. Like, what's the biggest part in the caregiver standpoint that can be definitely helpful.
Absolutely. And there's some things that, as physicians, you're able to lobby for, and you're able to, to see if you can access or mobilize resources for, like increasing the times that a mobile unit goes out into the community, or I don't know if any of the clinics that you guys work with have transportation where you'll go and pick up the patient and bring them, to you. So yeah, it is a challenge. It's important to know where the community is so that we know how to advocate on behalf of the community, but it is a challenge and a tension to figure out how to be ethical about it, because there's just, only so much that you can do. Okay, we have time for one more. If somebody else wants to share or has any additional questions. All right, well, thank you so much for your attention. It depends on your
She does.
I am working on that right now. What was the date? April 20th.
This was a nice class. I never thought about this one. This is